Zambula, and a very warm welcome to another episode of Dunso BBS. I'm Thang, your host, and in today's episode we'll explore another topic of great importance and interest, that is neurological disorders. And to lead us through this complex world of neurological illnesses, we will be joined by Dr. Sonam Jamtsho, who is a neurospinal surgeon at 𝗗𝗶𝘂𝘂𝗵 National Referral Hospital. Thank you so much, doctor, for coming, and welcome to the show. So together with doctor, we will explore and learn the causes, symptoms, diagnosis, various treatment options, and impacts of some of the common neurological disorders in the country. So doctor, first and foremost, what are neurological disorders and how do they differ from other types of medical conditions?
First of all, thank you for having me here.
Yes.
It's my pleasure being here. So at least talk about neurological disorders in our country. Okay, coming to your question, like when you say a neurological disorder, you will have to understand it's something to do with the brain and the spinal cord and the nerves. Basically saying it's something to do with the central nervous system. The disease related to the brain, spinal cord, and the nerves are totally different from the other parts of the body. Meaning to say, if you have a disease of a spinal cord or brain, the foremost thing is you might lose the cognitive functions, like the way you are communicating right now. We might lose it. You might be confused. Other thing is you might have some kind of neural focal deficit, like for example, you're having a weakness on one side of the body, like the legs, arms, or complete paralysis. But pertaining, if you have issues related to the nerves, you might have some kind of a tingling sensation, like pricking sensation in your extremities. So these are some of the symptoms that will be typically present in the central nervous system disease, which we define as a neurological disorder. So these kind of symptoms are basically not present in other kind of diseases apart from the neurological disorder.
Yes, doctor. So can you also tell us about the status of prevalence of neurological disorders in the country, and if there are, what are some of the most common neurological illnesses that you encounter in your practice?
Okay, it's just been like 1 year, 8 months that I've been working in 𝗗𝗂𝗵, and from the, now if I'm to be really frank, till now I have done like 1,037 or 38 cases of neurological surgery. From there, if I am to kind of club into the groups, I would say 60% of the surgeries that I've done in the patient had a brain tumor or spinal cord tumor. Okay, and from there, the 40% again I further divide into the one having a like a stroke, the brain hemorrhagic stroke, and having a ischemic stroke, like there's a clot in the blood vessel and causing the brain to swell up, causing a disorder, and also a traumatic brain injury. It compromises almost like 40%. Okay, from there again, if I further divide, there are so many numbers. But in that 60% that which I talked about, the brain tumor or the spinal cord tumor, again I further divide into the adult brain tumor and the pediatric or the children's brain tumor. From there, I would say 20 to 30% compromises of the pediatric or the children's neurological disorders.
Yes. So, as doctor said, brain tumor or spinal tumor is most common amongst the Bhutanese. So, can you tell us the primary symptoms of these neurological disorder?
Okay, when it comes to the symptoms, the thing is usually the symptoms are all similar.
Yes.
Okay. Now, when we talk about the brain tumor, let's think as a brain. You know, in a brain we have, if I have to divide into the components of the brain, we have the frontal lobe, okay, we have the temporal lobe, parietal lobe, and the occipital lobe, and the brainstem and the spinal cord. If you have a tumor in the brain, first foremost things that comes as symptom is a headache.
Yes.
Okay, and the thing is, the pattern of the headache is like the headache will be progressive in nature. one thing is like if you have a headache right now this month, next month the intensity of the pain will increase. Other cardinal symptom is like you will have like the headache early in the morning when you wake up from the bed.
Yes.
Or at the night you suddenly have a severe headache that you wake up from the sleep. Now these are the symptoms that usually comes when the severity of the disease is very high.
Yes.
But if you have a tumor which is located at a certain eloquent or the certain area which has a maximal function of brain, for example, in the brain there is a component called basal ganglia nucleus. It's something to do with the movement of your limbs. The left one will control the right ones, the right will control with the left one. If you have a tumor at the left basal ganglia nucleus, you're going to have a weakness on the right side. Now in this case, you might have a mild headache. You might not have a headache like early in the morning or late at night during the sleep time, but you will have a symptom as a weakness of the extremities. Now these are some of the symptoms it will come. Now if something to do with the spinal cord, for example, the spinal cord will control all the movements of your limbs. If you have a spinal cord tumor at the level of the thoracic, you will have the both lower limbs paralyzed or weakness in movement. You're going to have numbness, you're going to have pain prick sensation, or you're going to have a problem with your bowel movements, or you'll have urinary symptoms.
Yes.
Now these are symptoms which will come as per the localization of the tumor, as per the presence of a tumor in the eloquent area of the brain or the spinal cord.
Yes, yes, doctor. Doctor also mentioned about the pediatric tumor. So can you also shed some light on this?
Okay, when it comes to pediatric tumor, now the thing is, now I'll divide the pediatric into two things, okay? Yes. First is the congenital anomalies, meaning to say the moment the child is given birth, during the growth of the child in the mom's womb, there is a formation of the spinal cord brain. As per that, there's another kind of anomalies, like the malformations. Now that cannot be said as tumor, but that will go into the term as neurological, the spinal tube defect or central nervous system defect. Now when it comes to tumor, it differs as per age. Usually the pediatric tumor is something to do with in the brain there is a space called known as ventricles. It is an area where they have a brain fluid or CSF. Usually the pediatric tumors have the problem with the wall that lines the ventricles. From there the tumor arises. And the thing is, the most common pediatric tumor will be something to do with the formation of CSF fluid, sometimes at the brainstem, and less times it will be at the cortex of the brain.
So how is the diagnosis done? Because I think it's the tumor that is formed when the baby's fetus inside mother's womb. So how is the diagnosis done?
Okay, when it comes to the birth defects, that is totally a different topic.
Yes.
But let me go to the brain tumors in pediatric. Usually the first symptom they come is like they'll have an increase in the size of the head of the brain, head of the children's. You know the head circumference? It grows as per the age of the patient or the children, but sometimes it grows abnormally big. Now it could be there is a tumor in the brain causing the obstruction of the flow of the brain fluid, leading to a condition known as accumulation of the brain fluid or hydrocephalus. It causes increase in the size of the head, increased size of the head circumference of the children. Number 2, the patient might present as a seizure. Number 3, the patient might have a weakness. Sometimes it presents as a growth retardations. So anything that causes abnormal development of the kids, you should suspect there is something wrong with the brain or the spinal cord.
What are other neurological disorders that is common in children and likewise in the old age?
The thing is, the most common, I would say, the tumors that I have seen is usually in the brain you have the skull, you have the brain protective matter known as the dura. It causes a tumor known as meningioma. This is very common tumor. But meningioma also has a grading, grade 1, 2, 3, 4. Grade 1 is very benign. The more once you remove it, it doesn't grow back. Most of the time, 80% of the time, I found there is a meningioma. Okay, but at the same time, when you have a tumor from the brain parenchyma or the brain tissues, that is an aggressive tumor. Okay, now in pediatric, I would say the most common that I've seen is the brainstem tumor or the spinal cord, that we have the behind the brainstem, we have a term known as fourth ventricle. Okay, the wall of the ventricle which holds the space or holds the say brain fluid. Sometimes from the wall there is tumor, but unfortunately those are the aggressive tumor. Yes. So far I have met those kind of tumors, but touch wood, all the tumors had been removed, and the patient is doing well with the chemo and follow-up chemotherapy and radiation therapy.
Yes. And what about in the old age, other than NPH that doctor mentioned?
Old age, like you will have, like I told you, like the meningioma, the brain, the dura mater tumor. Then you will have the intraaxial or the tumor from the brain tissues.
So now are they similar in the children and in old age?
No.
How are they different?
In old age, the thing is the prognosis is not good if you have a brain tumor coming from the brain tissues. Usually it's aggressive. The 5-year survival is not really good. Okay. And in children, if you happen to certain conditions, certain brain tumors, the moment you remove it, they survive. And you have to keep in mind the children are kind of, when you're in the growing stage, the recovery rate is faster than the old age.
Thus, doctor, talking about spinal and brain tumors, what are the main causes of these neurological disorders? Are they primarily genetic, environmental, or a combination of factors?
For now, as per the research in the world, they found something to do with the genetics. Okay? And the other thing is, like, you have the external risk factors like exposure to the radiations. Okay? Sometimes it is a working environment. For example, the ones who are doing radiation therapy, they're exposed to the radiations. Sometimes the X-ray technicians, the radiologists who are exposed to radiations, CT, MR, CT radiations and all, they have a high risk of developing a brain tumor. Okay? But regarding the cause, when you say, we say the term risk factor, it will increase the risk of having a brain tumor, but it is not the cause. Okay? The usual term we say is idiopathic, meaning unknown cause. So in this juncture of the world, we came to conclusion, okay, certain genotypes, certain genetics have a high risk of developing a brain tumor. But it doesn't apply to everyone. But some unknown cause. Most of the time, it is an unknown cause.
So how do lifestyle choices like diet or exercise influence the development of neurological disorders?
Basically saying, we say lead a healthy lifestyle, right? So healthy lifestyle is not about just prevention of brain tumor. It is like having a happy life. You are healthy, you are happy, right? But the thing is, if you say, I'm going to exercise, I'm going to swim or something like that, it's going to prevent brain tumor, is wrong. Certain conditions, like let's say you're smoking, okay? You're smoking so many cigarettes in a day. You know that in research literature, it increases the risk of lung cancer. Now, when you have a lung cancer, the thing is, there is a term called metastasis, meaning it spreads to somewhere else. And there is a high risk of the lung cancer going to the brain. Sometimes the kidney cancer going to the brain. So, meaning to say, when you can prevent other conditions, at the same time, you can also prevent term as brain metastasis. But having, let's say, like living lifestyle, now, as per the professionalism of the radiologists, radio intervention, yes, they have to take precaution measures like put on the lead jackets, protect yourself from radiations. But you cannot, but basically saying, if I don't do that, I'll not get a brain tumor, is not there. Leading a healthy lifestyle is a key to be happy for yourself. But at the same time, yes, it might prevent, yes, it may not.
So what are the typical diagnostic procedures used to identify these neurological disorders?
Okay, first thing first, if the patient comes to chronic headache, like more than headache, having all those cardinal signs and symptoms which I suspect as having a brain tumor, I do a term known as computed tomographic scan of the brain, CT brain, okay? And the CT brain helps to give me a guide saying, oh, there could be a brain tumor. But to have a definitive diagnosis, to see the detailed tissues of the brain, the second thing I do is MRI brain. So these are two modalities which is commonly used everywhere in the world to diagnose the presence of or the absence of brain tumor or the spinal cord tumor.
Can you also explain what exactly is MRI?
Okay, MRI is a magnetic resonance imaging. Okay, in that case, we use the magnetic field. Okay, and then it gives a detailed structure, tissue structure, and we can use it for the detailed evaluation of brain tissues or spinal cord tissues. Keep in mind, compared to the computer tomography scan, CT brain and the MRI, it's totally different thing.
Yes.
Multiple X-rays makes a CT scan. So when you're doing a CT scan, it means to say you're having exposure to the radiation. Okay.
Yes.
When you're doing MRI, there's no radiation. It is a magnetic field. So one thing I would say here is, when you are doing repeatedly CT scan on the patient, whether you have a indication, no indication, indirectly you're increasing your risk to develop a tumor in any part of the body.
Yes. So after the diagnosis, what's the way forward?
Okay, now depending upon the location of the tumor, you have a choices of a surgery, then you have a choices of chemotherapy and radiation therapy. The thing is, for example, if the patient have a tumor in the ventricle, the space where there is a brain fluid, and it's causing obstruction, it causes the increase in size of the fluid. It causes accumulation of fluid in the brain. In such cases, I would put a diversion. I would put a term known as a ventricular drainage or external drainage to drain out the fluid, but at the same time I'll remove the tumor which is causing the obstruction. But once we remove the tumor, you might have to find out the pathologic diagnosis, or the what is it? Is it a aggressive tumor? Is it a benign tumor? Something you can remove and you don't have to do chemotherapy and radiation therapy. So usually the first line treatment will be the surgery 90% of the time. But if the pediatric brain tumor is located in a certain brain structure such as the brainstem, maybe you just go for palliative or just a symptomatic or conservative management therapy, or the chemotherapy or the radiation therapy.
Yes. So what can we as a patient or as a someone related to patient expect from the procedures that doctors
the thing is, like you know, whenever every surgeries that we perform in the hospital, not just neurosurgery, like general surgery, urosurgery, every surgery has a risk factor. Okay, there's a bound to have a complication. Now when it comes to my field, I would say the risk of dying, the risk of undergoing risk of becoming paralyzed, or risk of going in a coma is high. I will never ever say, oh, your brain tumor is very simple, I'll remove it, you're not going to happen. I'm not going to say it. Even if I know it, the brain tumor is very simple and I can remove it, I would always say the worst complication first. First thing first, the dying from the intraoperative complication, or having a paralysis, or depending upon the location of the tumor, losing of eyesight, or losing a speech therapy, losing a speech or something like that. Now these are the conditions that I have to explain before the surgery. You will never ever expect me to say, oh, you're going to find nothing's going to happen to you. It will be utterly wrong and unethical for me to say like that.
That's doctor. So it is evident that neurological disorders can impact the mobility, communication and independence of the patient. So what are some of the support systems available for them, the family members and the individuals suffering from these neurological illnesses?
Okay, here I think I want to kind of elaborate a little bit. When I'm instance, okay, I want to do a surgery. Okay, the patient came to the ER with a brain bleed. At that moment, the patient is not conscious. Okay. For example, you're the surgeon, I'm the patient's attendant. You know it. You as a surgeon, you know it. The survival rate is 50-50. Even if the patient survives, the patient might be bedridden or might be in a comatose state, right? But at that juncture, you will tell me, the thing is, if you don't explain and I say, please take my patient to the surgery, I want the patient to survive, Once you have done the surgery and the patient is bedridden for a long time. The problem here is, if I'm not mentally prepared that I need to take care of this bedridden patient for a long time, it is a torture for the patient. Okay, so in that kind of scenario, I every time explain to the patient party saying that the risk of becoming comatose is 50%. Yes, at that acute phase, you will say, please save my patient, please save my patient. Okay, but when the patient becomes bedridden, where the caregiver, the function is the very important aspect for the patient's life.
Yes.
Okay, if you fail in that duty, you know, the prolonged bedridden patients, they can't move their limbs, they tend to have bed sores. And if the patient's party is not ready to kind of have a complete treatment of a bedridden patient, I always tell them, think twice.
Yes.
Because if I do surgery, the patient becomes bedridden and you're not taking good care of the patient, you know, I'm not a saver of the patient's life. I'm the one who's causing harm. I'm the one indirectly torturing the patient. I'm the sinner, right? I don't think I'll be having a good days. Rather, I'll be having a bad days. And this is something I have to be mindful that I really let the patient's attendant understand. I'm going to do the procedure, the risk is like that. Will you be able to kind of take care of your bedridden patient? Because at that juncture, you will say, yes, I'm going to take care of my patient. Yes. But at the time goes on, you know, you have your own life. I don't have time. I have to go this, that. And the patient is neglected. Now, these are the scenarios that I'll have to ask my patient party, ensure that they're mentally prepared. If these things happen, they're going to take care of the patient. You know, this is a very ethical thing that I have to keep in mind every time.
Yes.
When the patient party agrees, I'm going to do that. Within 7 days, the patient develops a bed sore. I feel so bad. I feel guilty. Touch wood, if something happens to my family member, if I know the survivability is low, may go to the coma stage and all, I will never be selfish. Sometimes it's better to let go and accept. Now, this is something which you have to understand.
Yes, doctor. Yes. So, can physical therapy play any role in rehabilitation process of the neurological disorders?
Yes, definitely.
Yes.
You know, when I have a patient with a brain stroke or hemorrhagic stroke in the brain, brain bleeding, or when you have a brain tumor, which is causing weakness on the extremities, you know, after the surgery, the 90% of the work is done by the physiatrists or physiotherapists.
Yes.
They play a very crucial role in ensuring the patient have a good, if the weakness in the extremity, have a good motor power. Speech therapy, cognition therapy is all done by physiotherapists. So they have a very 90% crucial role in all the neurosurgical patients.
Yes. So how can early intervention and therapy help the rehabilitation process?
Usually, if I have a patient with the brain hemorrhage with the weakness on the right side, the moment I do a surgery, I remove the clot, everything.
Yes.
In a post-operative day 2, 3, I start the physiotherapy.
Yes.
Early the ambulation of the patient, early the recovery phase.
Yes.
That is the term.
Yes.
And other thing is, the physiotherapist will continue till 6 to 1 year.
Yes.
But the physiotherapists have their own certain period. They say like within 6 months, they give a golden standard time period where, yes, within that period of time, there's a high chance of patient recovering at least to 98%.
Yes.
Most of the neurological patients, they don't recover 100% if they have a deficit.
Yes. Yes. So, doctor, can you also share some of the insights of the common challenges faced at the moment, like access to care and healthcare facilities for neurological disorders at the moment, like in the country?
The thing is, since it's just been not even 2 years I'm here, so I'm in the process of acquiring lots of advanced equipment so that I can perform surgeries. My stay in Thailand for 5 years, where I trained for neuro and spine surgeries, their equipments are very advanced. When I came here, we are starting from the basics. But if you ask me a question, am I able to do all the surgeries that they do in foreign countries? Yes, I can do it. Yes, I've been trained there. I've done surgeries, all the sophisticated surgeries at Thailand. Here, we are doing good. I would say from good, we have to make it better than to excellent, right? Yes. But right now, we are in the process of having a sophisticated equipments. Yes. So my challenge here is like, due to limitations of the equipments, it's just current scenario. Yes, it's in the plan. It's down the pipeline. We're going to have all the equipments. Yes. So that in the current scenario is like due to lack of some equipments, I'm not able to perform some of the advanced surgeries. Yes. But yes, in next 2 to 3 years down the line, when I have all the equipments, all the surgeries that has been performed in other parts of the world, we'll be doing here. So the plan is there. For example, I'll tell you one thing. you have a disease like Parkinson's disease, right? You have a major depressive disorder. Yes. You have a condition known as obsessive compulsive disorder. Currently, in a country, it's treated by the psychiatrists giving medicines and all. Okay, Parkinson's disease was seen by neurologists; they give medicines and all. But the level of the treatment has reached such that now we do a surgery known as deep brain stimulation, yes. whereby you put electrodes in the nucleus of the brain, yes. with the sophisticated image, okay, and you put a battery out here. With this treatment, with deep brain stimulation, you can treat the major depressive disorder, you can treat the Parkinson's disorder, you can treat the OCD or other kind of conditions. Yes. Now this is a condition that I would say from all the surgeries, it's at a very advanced level. Yes. Now these surgeries I've done in Thailand for almost 6 to 7 cases. Yes. Okay, so this is something like where I've assisted my professors, where I've learned, and I feel in maybe next 3 to 4 years, with availability of all the equipments, yes. with the ability of my assistants, yes. we'll be able to do it. So I'm pretty much kind of optimistic in this kind of yes, things. Yes. But until then, yes, other conditions we'll do here.
Yes. So there is definitely a ray of hope in terms of like healthcare facilities related to neurological disorders in the future. What is the difference between degenerative, developmental and acquired neurological disorders?
Okay, the thing is when you say that degenerative, right? Degenerative is something to like, let me give a simple example of yes. when you buy a new car, right? Yes. You know it goes very smooth, the ride is smooth, it's very comfortable, right? Over the prolonged period of time, there's a wear and tear. We human beings are like that car. So even the brain function, the spinal cord function, over the years, there's a term called degenerative disease. Now, degenerative disease usually doesn't cause the brain tumor or the cancer, it's not there. But, for example, the spinal cord, you have the vertebral bone which covers the spinal cord. So over the years, over the prolonged use of your vertebral bone, of course we are sitting right now, right? So using there's a disc, there's a vertebral bone. Over the period of time, the disc, it leads to a term known as slip disc, which causes the compression nerves. Then you tend to have a numbness of your legs, weakness of legs. Now this is a term known as degenerative process. Now this is something which will eventually happen to all of us. Maybe right now we are young, but in the long run we'll become old, and we are prone to have this kind of a degenerative process. But I would say that degenerative process won't lead to brain tumor or spinal cord tumor. Is utterly wrong.
Doctor, can you give some examples of degenerative neurological illnesses?
One thing is like in old age, like for example, we have a term saying is, this is an old age disease. For example, grandparents and like this, they say, she's easily forgetting. She doesn't realize what she has eaten last night, right? Sometimes we say, she's not able to control her urine. She's like passing urine everywhere, and she's walking very slow. Okay. Sometimes she's eating food and having a choking. Okay. Sometimes she's very moody. Now all the symptoms clubbed together, there's a condition known as a normal pressure hydrocephalus. Meaning to say, over the process of time, your brain becomes small, atrophied. But at the same time, the brain space which I said usually has a brain fluid to provide the food to your brain. It expands. Meaning to say, the absorption and there's more production, less absorption. As a result, there's a accumulation of brain fluid in that brain space. Now, this condition happens in the old age people aged more than 60 plus. Okay, and when you have those kind of symptoms, usually we say it is because of like old age process, the degenerative process. Now, this leads to a condition known as NPH, which actually we have a treatment for that. Now, when it comes to spinal cord, it's something to do with your disc, vertebral bone. Okay, you have a strong vertebral bone. In between, there is a disc known as it acts as a shock absorber. You have a spinal cord in between. So when your disc loses the presence of water in longer process, known as degenerative process, right? Your disc becomes rigid. So it cannot absorb the shock. So it kind of comes out, propels out, and it causes the compression of the nerves. Okay, related to the movement of your legs, arms, and it causes a disorder known as if I'm to say in lay term, is known as herniated discs. It might lead to kind of a condition on weakness of your arms, weakness of your legs, or numbness of your legs or arms. So these are kind of the things that will happen in a degenerative process.
Yes. What about the developmental and acquired?
Okay, in a developmental is something like, the thing is acquired, there's no term as acquired brain tumor, okay?
Yes.
So you might have an acquired neurological condition, maybe from the trauma, maybe from the, let's say, the thing is...
Can it be from stress, accumulation of stress?
No, that cannot be.
Yes.
When you're talking of the stress, you're talking of the health of your mental status, health of your mind, right?
Yes.
Now, the stress is something else. The acquired conditions are something like over the period of time, you have an external factor causing it. Okay. Now, developmental is something like during your, if you're talking pediatric here, during your development as a baby in your mother's womb, that time the abnormal formation is there. So that is known as developmental process, developmental formation of the this disorder.
Dementia is also one of the neurological conditions.
Yes.
So is there a relation between dementia and stress?
Usually, like if you correlate with your stress, you know,
Yes.
when you're very stressful, you tend to think of certain things only. You are not focused in doing other things. Something which is important, you're not focusing there, but you're focusing on the stress, something you're having a deep thought.
Yes.
That's when you tend to forget, right? But that I won't say use term as a dementia. Maybe I would say as a forgetfulness.
Yes.
Okay. Now, when you say dementia, it should be age more than 60 plus. Okay. Now there's a term called senile dementia, meaning to say old age related dementia. No treatment, just related to old age. Now, certain pathology condition like the condition where I said accumulation of brain fluid in the brain. Okay. Then you have Alzheimer. Then you have Parkinson's disease.
Yes.
So these are the conditions which you can define as a disease, but with the stress related, very difficult to kind of correlate.
Yes, doctor. So, doctor, is there a difference between seizure and stroke?
Yes, seizure is like, you know the term convulsion, like you have loss of consciousness, your body shakes like anything, you have your eye rolls up, sometimes you have saliva coming from mouth, you have urinary incontinence, you have a bowel incontinence, okay?
Yes.
You convulse, you become tonic, or like there's so many seizures are there.
Yes.
If I'm going that, there are multiple seizures,
Yes.
okay?
Yes.
But stroke is something like when you have a rupture of blood vessel in your brain, or when you have a blockage of blood vessel in the brain, causing a swelling of the brain.
Yes.
This is known as stroke. Seizure can happen from the stroke.
Yes.
Okay.
Yes, doctor. Doctor, could you also provide some insights into the incidence and severity of head injuries related to archery, which is very frequent in the country, as well as the treatment procedures employed and the results?
Regarding the archery game, I know it's a national game, everybody loves to play the archery, okay? The thing is, the risk of dying from the arrow injury is very high.
Yes.
The thing is, you have, but yes, I have maybe 4 or 5 cases of arrow injuries, and touch wood, like from 4 or 5 cases, all of them are not all. 4 survived, 2 died. But the reason is like how the arrow gets penetrated in the brain, it determines the prognosis of the patient.
Yes.
For example, the brain has lots of blood vessels, okay? There's the artery, there are veins, then you have a brainstem. If your arrow reaches or it tears the blood vessels, there's a huge kind of, there's a huge gushing of blood in the brain. It causes a compression of the brain and the brainstem. In the moment you die, okay? But even if I successfully remove the arrow, there's high chance of dying because there's so much of blood oozing out from the artery, okay? If your arrow reaches to the brainstem, instant death, you can't do anything. But if the certain areas, like for example the frontal cortex or sometimes the temporary, if it spares the blood vessels and it penetrates to that, yes, the survival is good, but it comes with the complications. For example, if your arrow gets tracked in the frontal lobe, if I remove it, you're going to have changes in your behavior. Sometimes you might be very aggressive, sometimes you might be very depressed, okay? There will be changes in personality, okay? There will be problem with the memories. If your arrow gets hit on the temporal lobe on the left or right side, if left is dominant area, you might lose the ability to speak. You might lose the ability to understand.
Yes.
Okay. Or if it gets in the area in the parietal lobe where it's something to do with the motor area,
Yes.
you might become paralyzed on one side of the body. So sometimes the cerebral is good, but it comes with the implications. It
Yes.
comes with the complications. So these are something you have to keep in mind.
That's doctor. So as we are nearing the end of this episode, if doctor have anything that I have missed to reach it out to our viewers, then please do.
I would say like regarding the neurological disorders, there are so
Yes.
many things that which we might need to discuss in the longer run. But at this juncture, coming to the basic brain tumor symptoms, if you tend to have a headache more than 1 month with the increasing intensity of the pain, come to a hospital, get checked, get your CT or MRI done. If you have a headache with the vision loss, or if you suddenly have a headache with the weakness of the extremities, or if you have a headache with seizure, come to the hospital, get all the CT or MRI done, and make sure that you get checked.
Yes.
Because at the end of the day, out of 100 heads, your head is more important because you have to lead your life.
Yes. Thank you so much, doctor. And as we wrap up this another insightful episode of Drunso BBS dedicated to neurological disorders, we'd like to thank and extend our appreciation to Dr. Sonam Jamtsho for sharing your experience and insights. And we hope that today's discussion has provided you with a deeper understanding of neurological disorders and their far-reaching impacts. And folks there, please remember that knowledge is a powerful tool in fostering empathy and support to individuals and families with these conditions. So thank you so much for joining us, and as always, we look forward to having you tune in for our future episodes of Drunso BBS. Until then, take care and goodbye.